All having fun. That was a fun activity. Um, Now we want to move into introduce one of our main speakers here today, and he's one of the champion in health and safety and wellness in the workplace. And we're just going to his bio. Joel Moody was appointed as Ontario's Chief Prevention Officer effective September 15, 2021. Prior to his appointment, Joel was Chief Public Safety Officer and Senior Director of Analysis of the Electrical Safety Authority, and has over 17 years experience working in various labor organizations throughout the province of Ontario. Dr. Moody leads the Prevention Division and is responsible for the oversight of Ontario's occupational health and safety prevention system. He provides advice to the Minister on the prevention of workplace injuries and occupational diseases and on any proposed changes to the funding and delivery of services for the prevention of workplace injuries and the delivery of services for the prevention of workplace injuries and occupational diseases. He works with the WSIB and health and safety associations and related stakeholders to advance the transformation of an occupational health and safety system to the evidence-based and outcome-focused model to eliminate workplace injuries, fatalities, and illnesses in Ontario. Throughout his career, Dr. Moody has a champion innovative approaches to harm reduction and regulatory oversight. He is well known throughout the health and safety sector for his ability to build and maintain strong relationships with stakeholders, as well as his passion for worker health safety, equity, diversity, and inclusion are also central of his philosophy and leadership. Dr. Moody holds an executive education certificate in strategic management of regulation and enforcement agencies program from Harvard University, a Doctor of Medicine and an advanced certificate in epidemiology and biostatics from George Washington University, a Master of Public Health, International Health and Epidemiology from the University of Alabama in Birmingham, Bachelor of Science, Engineering, and Civil Engineering from Duke University. We met Health Safety and Wellness Committee at a Health Safety and Wellness Conference in Kingston a couple of years ago. That's where we met Dr. Moody, and his discussion with us is just his commitment to health safety and wellness and, at a higher level made a real meaningful focus for us to encourage him to come out and speak to us. And we wanted him to come and share with us what some of his thoughts. Welcome you, Dr. Moody.
All right, so good morning, everyone. I should say, bienvenido a todos, buenos dias, whatever language we can talk about from a communication standpoint. It's quite interesting to be here. So David, I know you're in the back. Thanks, my friend, appreciate it. Wanted to come and see you all last year. Schedule got a little messed up, I'll say that. But I told my staff this year I'm coming. And so 25th anniversary, congratulations on what you do. I want to say that wholeheartedly, and especially on behalf of Minister Pacini and the rest of our colleagues at Ministry of Labor, Immigration, Training, and Skills Development. Okay. We can't add any more portfolios to the minister. Hitting the wrong things. There we go. When I saw what you're going to be talking about today, I'm like, this is it. Because when we talk about communications, and I'll get into it a little bit later, fundamental for everything we do, and I love the slides, love the opportunity. So a little background, I actually teach communications at U of T as well.
Oh, gosh.
And why is that? If you're not able, and I'll start with Wilbur Schramm, it's the guy who talked about the whole concept of the sender or the source, the message to channel the receiver, and noise, right? In your message, you're not effective. And we're going to talk about that a little bit, because when we say it's, how is communication important and its vital role with prevention of occupational injury, illness, disease, and death. Because every day, we as workers, I count myself as a worker as well. We face hazards, all of those things we know that can prevent injury, illness, disease, and death are there, but we have to ensure that we have those proper communication strategies in place. So, I want to talk with you a little bit today about how do we talk about effective communication, because as I said, they're at the cornerstone of health and safety programs. They influence everything we do, from hazard identification. Am I talking some words we've heard before? No? All right. I was at the Workers Center yesterday, so they gave me some notes. Because we want to talk about how do we create a proactive culture within our workplaces, not reactive. So as you heard, I'm a physician as well by training. I don't want to see you, basically, when I was practicing oncology, I don't want to see you when you have developed your cancer. I want to see you such that we're preventing. And that same mindset we bring with our jobs every day. So when we talk about communication, it's not just about exchanging information. It's about making sure everyone within our workplaces, our homes, understand what are the expectations, what are the hazards that exist, and what are those procedures that we need to be fully aware of and actually put into practice. The clear communication ensures that, one, your safety protocols are understood. So everyone, senior management, middle management, those of us who are on the tools, we must know what the procedures, as well as what are the consequences if something goes off the rails. When we don't have proper communication, or when we say it's inadequate, confusion happens. We just had an example of clay. I love clay. I have 2 younger kids at the house, and even in my world, when I say, let's put our socks on, did I say 2 matching socks? My youngest is 5. She says, "Dad, I have socks on." I'm like, "Yes, you do." I was not clear, but you answered, and you do have socks on. But once again, was I clear in my communication? Was there some different understanding? Because she did put on socks. 5-year-old. So we know who's the smartest person in my house is. Number 2, how do we understand and identify that the risks that we have are properly mitigated? So failure in communication results in hazards going unnoticed, therefore they go unmitigated. The workers, we're sometimes the first to actually recognize what's going on. Imagine that. But what if you don't have the channels, or if you even have the channels to report? Are people taking them seriously? And if they do, are they following through to ensure that those risks are addressed? Fostering the culture, fostering that concept of a safety culture. We have to have a workplaces that's fair, safe, and healthy. And in doing so, it creates an open and honest environment where everyone is encouraged and respected in the workplace. That's where safety thrives. Safety is not a priority. Safety is a value. Because what happens when we have priorities? They change. Should we be changing priorities around safety? A value is something that's rooted within what we do. It's rooted within our ethos. It's rooted within our DNA. It's a value. So, let's talk about effective communication. I'll try to break it down just a little bit, and I need to stop touching buttons, because that's just, I need to stop. So, we've all heard around that concept of, top-down communication, where, management's involved, they clearly understand, they consistently communicate the goals and the priorities. When leadership is proactive in promoting safety, it sets the tone. Okay, that's one. Bottom-up communication, we heard about that, where, we as the workers, we often have that direct experience with the day-to-day operations and understand the risk, but also the rewards as well. Creating those pathways for your fellow workers to share their insights, so important. It's essential when we talk about hazard identification and addressing not only known concerns, but what about the ones that emerge every day? Peer-to-peer. You're sharing yourselves, you're sharing the tips, you're sharing the reminders, observations, all those things. I try not to separate them that way, because at the end of the day, it's about the shared responsibility that exists amongst us all. Employer, employee, union, non-union, supervisors, it doesn't matter, or at least it shouldn't. If we are truly honest with ourselves, if we're truly honest with what we're trying to do, when we have a health and safety workforce, businesses are productive, communities are successful, and we as a province are successful. Sounds like a good solution to me. Today, we're working at paces that are different than what we did 3 years ago. Heard some conversation at the table I'm sitting in. We're now talking in the world pre-pandemic, post-pandemic. This kind of markers. What do we do prior is not the same as what we're doing now. So there we have new tools, new technologies that are in our workplaces that are supposed to enhance communication. From apps to reporting system, how are they providing more timely access to information, real-time updates? But what if they're not used? What if the systems are actually getting incorrect information into the system? Do we check? Do we question? Do we validate what's in there? Oh, and actually, do we still talk with each other? Or do we simply send a text? I said, got some kids at my house. They're upstairs. I'm like, why are you texting me? I'm just down the hall. Come and say hello. Or your phone will be mine for a little bit. Just saying. But that is their reality. I was watching and going down the YouTube rabbit hole a couple of nights ago. Yes, this is how I wind down a little bit. But for those of us who are Gen Xers, they raised the question around, we're the last generation that knows the world prior to cell phones. We're the generation that knows what a rotary phone is. Click, click, right? Exactly. The things that we've seen within our lifespan, other generations have no concept, no idea. So when we talk about, and there's going to be a discussion later about that generational discussion about communication, remember that. Because some of those are the barriers that exist. Because despite all those improvements in communications, sometimes we don't have effective flow of information, or those challenges exist. And I'll talk about one is language barriers. So once again, love languages. I think I speak English, but I do speak it with a Southern dialect coming from the South. Because when we have differences even in language, it can lead to misunderstandings. So to counter, you have to be clear. You have to be consistent, and if necessary, provide it in multiple languages that are understood. Prime example, when I first came to Canada, I said, hey, I need to go and buy a toboggan. I learned here in Ontario, in Canada, what is a toboggan? In Alabama, is a toque. Oh. So you can imagine my friends taking me to a sporting store. I thought I was being clear. Vernacular, slang, versus I just need something to put on my head because I'm not from here and it's cold. But we called them toboggans. Once again, am I saying some things that you don't see on your job site? Once again, I will always tell you straight up. I will always. Fear, hierarchy, reprisals, they exist because in some organizations, we're hesitant. Because there's the fear of negative consequences. How many times do you always hear the road to zero, or striving for zero work time injuries? Great goal. But is it fostering negative consequences? Because if someone reports, oops, we are now not at zero lost time injuries, and therefore we lose that trip that we're going to be getting for the team. Right. But that's not the purpose of reporting. The near misses are equally as important as well. And then, once again, we live in a technological age where TikTok, Instagram, I think that's two that I didn't know about, Facebook, whatever. We're getting a lot of information all at once. Are we digesting all of that? Really digesting all of that? Are we skimming? And therefore, by we're skimming, it can lead to disengagement. Oh, another email just came through, delete. Oh, another email just came through, I'll just look at it tomorrow. And then tomorrow comes and it's like, oh, I got more emails, I'll get to it next week. You have to have communication that's concise, targeted, relevant. When we originally thought about, once again, the purpose of emails, it was supposed to be one item per email. But how many of us get emails that say 1, 2, 3, 4, 5, 6, 15? Where do I start? You're lost. Information overload. Because once again, technology has sometimes exacerbated those issues. Because now you can write forever. Whereas, once again, Gen Xers, typewriters existed. Yep. CC, BCC, carbon paper. You didn't write a lot because you didn't want to make many errors. Once again, correction fluid, erasers, you know. So your memos were short. Those messages were short, concise, to the point. So, as we move and think about communication as far as prevention, thank you for an introduction. I'll work with my staff to cut it down because it's too much. I have to practice what I'm talking about from a communication standpoint. When we talk about how we look at safe work procedures and practices, communication is equally as powerful when we talk about prevention in relation to the equipment, the tools that we're working with. First one's around training and education. Ongoing training is crucial because it makes sure that we as the workers understand how to do the job safely and properly. It has to be interactive. You have to encourage questions, those practical examples that are relevant to the day-to-day task. Real-time updates. In many industries, conditions around what you see and what you do, they change very quickly. Whether you're getting something new, any type of equipment that's coming in, and it shifts how you do your work, hazards that are emerging, we as workers need that information to be up to date and as accurate as possible. So we have to have that robust system that allows those new risks to be addressed immediately. The one that often people forget about, feedback. When we talk about prevention strategies, how do we know if it worked or not? How do we know if it was effective or not? There always has to be dialogue. There always has to be communication between all of those that are part of the workplace, management, workers, everyone. Because we have to feel confident that our feedback is heard and acted upon because our input's of value. Even if they say, well, we can't do that right now, okay, you have been informed. But you've also told me maybe not right now for other reasons, and that's okay. But at least I'm not left without an understanding. Leadership. If anyone writes a good book on leadership, please just send it my way. I'll gladly pay for it, because leadership is key. You as a member union, your leadership, your tables, your groups that are there to help. If you didn't have good leaders, you'd have disarray. Why is a workplace any different? Because it helps shapes the culture of the organization. Leaders who are effective just don't send out emails. They just don't send out information. They foster that environment, not only safety, but quality. All those things are important. It's a priority, it's a value where the communication is integral. What are some of the things that good leaders, key leadership should be thinking about? I was always taught lead by example. Model the behavior you want to see. What's the other way that we say it? Walk the walk. And communication? Not telling you things you don't already know. Put it into practice. Open doors. I do not sit behind desks. I'm happy to be with you today. Even with my staff. As a teacher, what do? We have office hours. Anytime my staff can come. Anytime you should be able to also talk with your management about anything. How many of your managers or yourselves have open door policies? Encouragement to allow people to come and talk about concerns, or even just talk about, hey, what are you going to do this weekend? I won't talk about hockey, game last night, not so good. But create the environment where there's no fear, trust. Regular meetings that add value. So, and make sure you have those updates where you can recognize the achievements of people and reinforce the importance. Do not simply have meetings for having a meeting's sake. Once again, we've all been there. What is this meeting about? I could be doing some other things to actually get my job done, but I got this talking head. It's okay. It exists. This is the reality that we have. Make sure you get the feedback to them and say, you know, that meeting that you took 20 minutes, we could have had a 5-minute huddle and you could have been done and we got it and we can move on. Now, communication, integral, as I said. Give you a couple examples in my world where when we don't have good communication, things can not go well. Apologies for your toe. Where are you? Oh, sorry. Physician. One of the first things that we are taught when we're going through our surgery rotation is ensure that you've completed your checklist. Okay? We call them never events. You should never leave your equipment in a person. All right? You should never operate on the wrong site. Okay, let's talk about this. When sometimes you're going for those surgeries, or you're going for any procedure, have you seen your physician or whoever's nursing, the scrub techs, whatever, they put marks on your body? Why do we do that? Never events. You check, you double check. Let me see your wrist badge. Please tell me your date of birth. Are you who you say you are? Protocols had to be in place because, unfortunately, there were errors committed. Errors were committed. Lack of communication. So that's how important, and I stress that even if you miss that single piece of information, it can have catastrophic effects. Just an example. How does that relate to your workplace? Now, successes. You're on the job, you identify, you see something, it's like, oh yeah. When I was with the Electrical Safety Authority, one of the big items that we talked about was overhead power line contacts. Okay? Everywhere. 14.4 kV, talking to a good group here, electricity. Many people don't understand and recognize that, yeah, that's a bare conductor. You mean it's not anything, there's nothing plastic around them? No. They need to be cooled. Ambience. So reminding people when they're working, raising ladders, look up, look around, look out, before you start the work. Because typically, what's the material that most ladders are made of? Last I checked, fairly good conductor. Right? So looking out. So there, once again, feeling confident that the workers are doing the things appropriately and properly, and you're communicating not only to yourselves, but your crew to others. That's how you ensure that right now, when we look at fatalities in the province, less than 1 per million. If we had that same success on car crashes, if we had that same success upon cancers, what would we do? We'd be jumping up and screaming. Less than 1 in a million risk of being involved in a motor crash. We're not there yet. We're going to get there. Technology, as I say, good tool. It's it's creating new enterprises, it's creating new jobs. The mobile platforms, once again, big fan of that thing that you have in your hand called your cell phone. More computing power, as they say, than it took to put people on the moon, et cetera, et cetera. You've heard of it. It's a tool. It is not your answer. A tool is there to help you with your job, to help you with what you need to do. Because it could be, apps developed that give you early warning, that sends you information, that real-time work. That's good. What about wearable technology? As you start to get closer to an electromagnetic field, you start to glow your clothing. Ooh, things you can't see. Confined spaces, you actually go in. Remember, how many of us remember the mining stories? What did we used to do in old coal mines? Why? They did. Once again, the concepts have always been there. using other methods to go and explore. I know in our minds now we're actually looking and using drone technology. Let's send another device in where we don't have to send a human or the canary anymore. Right? Right? Communications, health, and safety, so important. And one that I'm a little biased to, you get all those informations, you get those observations, you got to analyze them. You have to tell the story. You have to put it in a way by which people can understand what are the risks, what are the hazards, such that we can develop the interventions as necessary. And then we measure and monitor them to see if they're making a difference. Yes, I love data. I'm a geek. It's okay. So, closing. I've taken some time. I hope this is resonating with you because the conference that you have today and tomorrow, amazing. Steering committee, David, rest of the group, going to be here for the majority of the day because I want to listen and hear and learn. Want to ask you maybe to do a couple things, not only today, but also when you go back to your organizations. Because we want to ensure that we're always in motion, that we're actioning and moving things to improve for the better, not improving things to make it worse. So how do you have your clear reporting procedures? How to report those hazards, how to ensure that near misses, who's responsible for acting upon those reports. And one of the great things I heard this morning was when you were doing your first aid. If there is an emergency, who is responsible for calling? If there is an emergency, who would be responsible for ensuring that, once again, they even know where the defibrillator is and then get it and come back? Right? All those things are so important before the event happens. One thing I would add is the note taker. Oh, yeah. Note taker. That's all right. Because when the person's calling, what are they talking to the dispatch about?
Everything they've seen and documented.
Hi, I'm calling from X, male or female, shortness of breath. Are they on any medications? It helps before the event happens. Have your safety briefings. Holding them consistency that adds value. Ensuring that they're updated, they're consistent, they're constant, and allowing everyone's voice to be heard. Not the one that speaks the loudest, not the one that speaks the softest. Everyone. Shared responsibility. And as we go into the new age, as we talk about the diversity that exists within our workforce, not everyone speaks English or French. Not everyone has great visual acuity. So whatever aids you're using, posters, digital displays, infographics to, relay those key messages, ensure that they're accessible to all. Love the prompts that we had on the videos as well, right? Those things matter, they help. And invest in training. Ensure that the safety training isn't something that you do just because you have to do it as a tick-off, you do it as a one-off. Consistency. Update it regularly through the feedback of yourselves. So as I said, communication's just not a simple tool. It's a lifeblood. It's about how do we effectively use it to embed within our health and safety programs. We use it to ensure that everyone is aware of the hazards that exist, as well as what are the procedures and processes to mitigate those hazards from creating the risk of injury, disease, or death within our workplaces. Workers, we all should feel empowered because we are making an active contribution to the culture that we work. By being clear, being open, being proactive, I know that we can prevent those incidents from happening, because at the end of the day, we want our workplaces to be safe, resilient, fair, and a good place to work and have fun. So, thank you very much for letting me chat a little bit this morning. Looking forward to the rest of the speakers today.